Good morning, folks. John Adamson, the Rehab and Documentation Guru, and today I'm going to read an article for you. It's by Skilled Nursing News, and it's entitled, Pendulum Swung Too Far. Therapists raise concern over layoffs, clinical changes under PDPM. And this was dated February 10th of this year. It's 4 months into the patient-driven payment model, PDPM, and despite some industry analysts pointing to early gains for nursing homes, many occupational, speech, and physical therapy advocates continue to criticize layoffs and changes to resident care patterns. On the operational side, the initial PDPM returns have been positive. For instance, 67% of nursing homes saw daily increases in Medicare per-day rates in November, according to the latest analysis from Zymet Healthcare Services Group and its affiliated data firm Core Analytics. But on the ground, the shift from the minute-driven system to the new PDPM, with its incentives for group and concurrent therapy services, has been met with uproar from therapists who claim they're being undervalued. By the way, the incentive for group and concurrent is only financial, obviously, and has nothing to do with patient-centric care and was not Medicare's intent. So this article is a little bit off on that. Some clinicians believe they're caught in a bait and switch, with bad medical decisions as a trade-off for higher reimbursements and the bottom line. What seems to be some recent relief from squeezed margins for operators could also result in lower outcome scores, you think? Leading to increased visits to the hospital, some therapists say, potentially wiping out any financial gains through readmission penalties. To therapy associations. I can't believe they don't even mention who these people are. We don't know if it's APTA, we don't know if it's ATA, we don't know what's going on. Two therapy associations opted to find out exactly how therapists and administrators are faring with PDPM to date, and nearly 5,000 respondents didn't paint a positive picture. I bet there would have been a lot more if everybody knew about that survey. Thousands of responses poured in, suggesting that fewer minutes and potentially inappropriate therapies led to more complications for residents. While more therapists are being laid off and facing underemployment and increased work pressures, resulting in serious morale problems. Okay, now they're starting to mention the American Occupational Therapy Association and the American Speech Language Hearing Association collected about 635 responses to their survey, respectively, and shared the feedback with Skilled Nursing News last week. One of the intentions of the new program is to do some correction and fine-tune of overutilization, but we feel the pendulum has swung too far. Sharmila Sandhu, OTAs Vice President of Regulatory Affairs, said. Anyway, it goes on to talk about other stuff. About 48% of occupational therapists claimed a nursing facility was mandating the provision of group and concurrent in place of individual therapy, regardless of the patient's functional level under PDPM. So, nearly 50%. We knew that. Of biggest concern is what we don't believe that therapist clinical judgment should be overridden by policies. And really the policy is not the problem here. It's the people that are paying the salaries of these therapists. We didn't ask this question, but a significant number of members reported layoffs or decreased hours of services. They voluntarily offered their company names, so we have some information. So they didn't ask that question. Well, that would have been a really good question to ask AOTA and ASHA. With reduced therapy times and layoffs, the fear among therapists is increases in falls and readmissions to the hospital that are potentially preventable, Sandhu said, and those are quality measures that these skilled nursing facilities will be judged upon. And so it's important to note that CMS is watching that as well. Anyway, the article goes on, but you get the gist. We knew this already. Skilled nursing facilities are making more money on average, and therapists across the United States are seeing the squeeze. We knew that. And wait till the outcome measures come back. I'm really hoping, not for the sake of the patient, obviously. I want the patients to do well, but that this shows the value of therapy and what happens when you get rid of it. Anyway, John Adamson, the Rehab and Documentation Guru, on this bright and sunshiny report, wishing you a happy Monday. Take care. God bless.